So, today we'll begin a simple primary care review on personality disorders. Personality consists of enduring patterns of perceiving, relating to, and thinking about the environment and oneself that are exhibited across numerous social and personal contexts. A personality disorder is diagnosed when personality traits are so inflexible and maladaptive across a wide range of situations that they cause significant distress and impairment of social, occupational, and role functioning. There are three clusters of 10 personality disorders based on DSM 5. Cluster A characteristics. Cluster A characteristics, which is individuals may appear odd and eccentric. This includes paranoid, schizoid, and schizotypal. E characteristics. This is where individuals often appear dramatic, emotional, or erratic. This includes antisocial, borderline, histrionic, and narcissistic. Cluster C characteristics. Cluster C characteristics are individuals often who appear anxious or fearful. These are avoidant, dependent, and obsessive and compulsive people. Clinical manifestations. The consistent presentation with onset in middle to late adolescence and continuing into adult life is particularly suggestive of a personality disorder. This includes frequent mood swings, angry outbursts, social anxiety sufficient to cause difficulty in making friends, need to be the center of attention, feeling of being widely cheated or taken advantage of, difficulty delaying gratification, and not feeling like there is anything wrong with one's behavior, like ego-syntonic symptoms, externalizing and blaming the world for one's behaviors and feelings. Paranoid. Distrust and suspiciousness of others such that their motives are interpreted as malevolent. Schizoid, the definition would be detachment from social relationships and a restricted range of expression of emotions in interpersonal settings. Schizotypal definition would be social and interpersonal deficits marked by acute discomfort with and reduced capacity for close relationships, as well as by cognitive or perceptual distortions and eccentric behavior. Antisocial disregard for and violating the rights of others, lying, stealing, defaulting on debts, neglect of children or other dependents. Borderline. The definition would be instability of interpersonal relationships, self image, affects, and control over impulses. Histrionic. This would be excessively emotionality and attention seeking. Narcissistic. Grandiosity in fantasy or behavior, need for admiration, and lack of empathy. Avoidant. This is social inhibition, feelings of inadequacy, and hypersensitivity to negative evaluation. Feelings of inadequacy, inability to make one's own decisions, submissiveness, avoidance of confrontation for fear of losing source of support. Obsessive compulsive. Preoccupation with perfectionism, mental and interpersonal control, and orderliness at the expense of flexibility, openness, and efficiency. Impact of the disorder: physical injury from fights and accidents due to impulsive and reckless behavior, suicide attempts, unplanned pregnancy and high risk behavior, comorbid anxiety, mood and or substance use disorder, comorbid physical disorders including cardiovascular disease, arthritis, diabetes, and gastrointestinal conditions, which reduce the life expectancy. Functional impairment. This includes self-care, work, and interpersonal functioning. Management. A treatment plan should be developed, discussed, and modified over time with the individual and group therapy, medication, self education, specialized substance use, disorder treatment, partial hospitalization, or brief hospitalization during times of crisis. Psychotherapy is generally regarded as first line for patients with personality disorders. Medications are generally used only as adjuncts to psychotherapy in patients with personality disorders. Patients significantly impaired by a personality disorder will most often benefit from early referral to a mental health professional. Thank you.